take them. Anybody that wants a vaccine has had the opportunity. Thus, why, to the next point, I think the county commissioners voted to open our county May 1st. They proposed a plan that's passed through. It's currently within the state hands to see if they will approve it. I'm kind of doubtful. Our plan was a little weak, but we'll see what the state has to say. Basically, May 1st, according to the county commissions, this pandemic will now be over. We can go back to life as normal. No mask, no fuss, no muss. Do what you want, essentially, is their recommendation. With that caveat, we will continue to measure and monitor for COVID-19. If we see 3 out of the 4 beds at the county hospital filled with COVID-19, we have more than 4 beds, mind you, but we have 4 COVID beds. 3 out of the 4 being filled, they will meet and try to discuss remediation or changes to the status of the county. And speaking with the mayor, he asked that I put a few suggestions together. So I'd like to go over that just to let you know where we're at. I think we need to continue to educate and inform our citizens. An educated population is a great population to be part of. We can make choices. We all have our free choice in our agency. We can choose to follow guidelines. We can choose to follow rules. There's not one citizen in the city of Ely that has not been impacted in some way by the COVID-19 crisis. We all know how to prevent it. We wear a mask, we socially distance, we wash our hands. I know the masks are controversial, but that's what it's taken. Ely business has been hurt to some degree. Our staff, or our businesses have been hurt. We want to take steps, and I'd recommend that we take steps to try to alleviate that pain and to continue to help our businesses succeed. We've taught, as I discussed, all our citizens how to be careful and how to prepare. It's time now, I think, to cut them loose. Let them decide. I'll be respectful of you, and you be respectful of me. Councilman Flangus, I wasn't, when we talked about masks, I had no judgment going on. Just want you to know there was no judgment. That's how I want our citizens to go forward. If you feel comfortable wearing a mask, wear a mask.
Yes, my doctor recommended putting half my oxygen because it improves my breathing.
Yes, sir, I would agree with that. I could tell where you had supplemental oxygen that the mask wasn't appropriate in your case. And so I don't have a problem with you not having a mask on, sir. You can take it off if you feel so inclined. Again, that's where... No, don't feel guilty. That's where we need to be as Ely citizens. We need to respect each other. If you're a business owner and you want people wearing masks when you come in my store, we as citizens need to respect that, put a mask on and go and support them. If they don't want a mask and you don't feel comfortable wearing a mask, don't wear a mask. That's kind of where we're headed, in my opinion. We need to continue to get support from the city on vaccine efforts as they arise. You have lots of upcoming summer events. There's some great little things we can do. We can make the parade route longer than usual, just socially distance and spread the people out along the parade route. Maybe instead of 3 blocks, we go 4 or 5, maybe 6. Spread the people out so they're not all crowded in the shaded park there. We can have more hand sanitizing stations put out when we have events. The city, I know, manages a couple different public restroom facilities. My recommendation would be, if you clean that once a day, then maybe we look at twice a day. If it's once a week, it's twice a week. I don't know how often these facilities get cleaned. That's a very simple task moving forward to help reduce the spread. We can encourage social distancing where we can do that, but the most important thing you can remember is we need to have these events. Citizens are ready. They're ready to be, this pandemic to be over. They're ready to go have fun. Everybody's excited for the big 4th of July. Everybody's coming home for the all-class reunion. These events are important to our county and our city. We need to support that and make them happen. I will continue to be in my position and offer any advice or support that I can, but I will not be limiting anything if our plan passes, I guess, on the state level. I do want to commend this council, and the Ely City has been wonderful to work with during this time. Our mayor should be commended. He has done an excellent job keeping the radio messages going, visiting with businesses, and helping me personally to help determine, where problems are and things that we can do better. Along with that, it should be noted that my recommendation for the city is if we find a problem, as far as, the county's come out and said 3 out of 4 beds, I would say as a city it'd be better to say, if I can trace a bunch of cases to a local establishment or a local activity, that we have a discussion with that group, and I'd ask the city for that support. That we go to the individual and say, hey, look, you're having a spread, what's going on? Oh, you're not washing your hands. All right, well, let's start washing our hands, whatever it is. But again, don't limit business and commerce activities. Do everything we can to keep it moving forward. That's all really I have to report, Mr. Mayor and Council. I welcome and entertain questions. You have concerns? Welcome to
Councilman Hall has some questions.
I got a question. On the 36.07% vaccine, you have that broke down by, for example, any age group that, say, more prominent getting the vaccines? And also, and I say that we have hardly any ethnic big boundaries around here, but how does it compare with the tribe? I know the Robinson Mine, they have a program for the employees to get vaccinated. I believe they get a monetary payment.
They get $250 if they choose to get vaccinated, is my
We're just
understanding.
sort of trying to key in on the Shoshone tribe. How's their percentage look to the rest of the population?
Certainly. So I had a discussion with Garrett, he's the pharmacist / clinic director for the local tribe, Garrett Garber, excuse me. The tribe is currently at like 44% have been vaccinated on the tribal level. As far as age groups for our county and our city, those with pre-existing medical conditions were the majority of those. So, and when probably the 65 and older crowd are probably the majority of those who were vaccinated. And the reason being, this group of individuals, not only were they, a lot of them are greatest generation, you got to think, I can remember my parents had a scar on their arm. That scar was smallpox. Well, guess what? They're not smallpox anymore because the vaccine worked. So this generation, I think, the older generation was more likely to get a vaccine because they've seen it in their own lives work and prevent disease. So I think, Councilman Oliver, that's what we would also find. It has not been broken down by age and demographics per se. I could dig deeper though and get you some better numbers if you'd like.
That's fine, thank you.
I do have a couple questions. Is the hospital going to continue doing free COVID testing for anybody that shows up during those morning hours?
Definitely. We have seen a huge decrease in testing numbers. I believe COVID is still alive and well in our community, but we're just not catching it. But the hospital does still offer free testing from 8 to noon, no appointment. Show up in the little roundabout, nurse or medical assistant will run out, test you, and we'll call you with the results. So yeah, that's still available, Mr. Mayor.
And then I was under the impression that the county's reopening plan had been approved, but that's not the case.
That's not the case. In speaking with Matt Walker, the CEO of the hospital today, the plan has been approved by the county, the Rural Nevada Hospital Association, and now is in the governor's group of people's hands. And the report we're getting back so far is it's pretty sparse. They commented on how there really wasn't much of a plan there.
So what is the plan forward there? Do they have a certain time they're supposed to respond by, or are they going to send something back?
They'll probably send something back. I don't know the exact time frame.
Okay.
It should be noted also, Mr. Mayor, that I was not, as a public health officer, involved in any way writing our personal plan. which was odd, but that's okay. That's the choice the county decided to go with. Like I said, they're ready to be done. And, I can't blame them. I think we all feel that way. Other questions?
In my discussions with our public health officer, much like he said, I don't think the city would benefit at all by implementing any sort of their own restrictions. I don't think that's the route we should go, but I felt pretty strongly that working off of our public health officer's recommendations, we should at least have a statement out for May 5th, outlining a number of these things, such as continued vigilance against if you have symptoms, go get tested, making them aware of vaccination opportunities, and encouraging them to continue to work with our county health officer if they do experience an outbreak, because I think what has saved our community a lot of heartache is that our public health officer has been so responsive. If there has been an outbreak, he went down and worked with them. We were able to contain that. We were able to test. It saved us from a lot of unnecessary lockdown and a lot of unnecessary overreach, because we were able to pinpoint the problem rather than just trying to bludgeon our way through it. So I appreciate the report, and that will take us to our next, if there are no other discussion or questions on that, that will take us to our next item. Mayor Robertson, White Pine County Public Health Officer Darren Coombs, Farm D, discussion for possible action, approval of City of Ely statement regarding State of Nevada COVID-19 Roadmap to Recovery Transition Plan, effective May 1st, 2021. And it should also be noted that the state is looking to turn over control of any restrictions and going forward to the county starting May 1st, but the state still does have a mask mandate.
They do, to my understanding, it's through June, or sometime in June, will technically end June 1st, is what the governor's proposing at this time.
Okay.
However, the county commission has voted that's not going to happen. May 1st will be the day.
Okay.
And so it'll be, I don't know, who's stronger, bigger, wants to fight harder, I guess. Truthfully, Mr. Mayor, none of our local businesses are really following the guidelines anymore. You walk into any store, the masks are off, the people are happy, they're just doing their thing. Good, bad, or indifferent. So, again, we've taught people to do what they can. I think it's important as citizens we just try to respect each other. And if you feel comfortable wearing a mask when you're in the grocery store, wear a mask, but don't give anybody a hard time because they're not, or that they are. Let's all just get along.
So I'll entertain some ideas and thoughts on this from the council.
So I don't have a problem approving a statement, but we don't have that statement.
No, we just have some recommended bullet points, and I guess what would be appropriate would be to, just for the council to vote on what they'd like that letter to contain as far as these bullet points, and we can make that up.
I think the bullet points that are outlined here are good. I mean, they look good to me. If that,
I would agree if you agree with those bullet points, yes.
I would hope so, you wrote.
Yeah, I wrote. We might, Mr. Mayor, we might not need to have the section that says upcoming events. I don't think the citizenry needs to know what we're going to try to do, or extra cleaning the restrooms or hand hygiene. But I think if the city came out with some sort of statement that basically said, look, you know how to prevent the spread. As a city, we're going to continue to monitor and try to squash, quell, whatever word you want to use, outbreaks as they occur. Everyone just needs to be respectful of the business and citizen. If they want to wear a mask, great. If they don't. If they want to get a shot, great.
Well, I think identifying that we'd be, quote unquote, squashing the outbreak through education and testing,
Not through fines, not through shutting businesses down. I don't think it will come to that point. Everyone has been wonderful.
And I think our education and testing rep has served us very well over this past year, so that being the case. I'll entertain a motion or other ideas from the council.
I would move to approve a statement containing those first four bullet points as outlined in the report from the public
We have a motion from Councilwoman Beecher. Do I have a second?
I'll second.
Second from Councilman Carson. Any further discussion?